And we have hit another grim milestone in the fight against COVID-19. More than 3.5 million people worldwide have been confirmed to have the virus. The U.S. makes up about a third of that number with over 1.16 million. The numbers are climbing, but Florida is starting to reopen parts of its economy today. Some stores and restaurants are now partially open, but schools, gyms, and bars remain closed. Meantime, Secretary of State Mike Pompeo is backing up White House claims that the coronavirus was manufactured in a Wuhan lab. He said this weekend, quote, "a significant amount of evidence exists." He would not elaborate on just what that evidence is. All right, joining us now to discuss more about the coronavirus pandemic is Yahoo Finance medical contributor and Columbia University Associate Professor of Emergency Medicine, Dr. Dara Kass. Doctor, thanks again for being with us. Good to see you. You know, the U.S. has succeeded in flattening the curve, but we're seeing here the number of new cases each day, the number of new deaths have not fallen much, especially in contrast to what you're seeing in Asia and in Europe. Why do you think that is?
So I think that the real answer for that is consistency. We don't have a consistent approach to testing and tracing. We don't have a consistent to help in our environments, even if we decided in two different communities to open up different businesses. Let's say one community wanted to open up maybe a small coffee shop or other kind of low traffic areas, and maybe somebody else chose a manufacturing plant. It's the same metrics that we would want them to have. How many tests do you have? How's your ICU capacity? How many patients have you seen in the past 48 or 14 days that have had the virus? And it's the inconsistency and really the lack of kind of federal guidance that I think is why we're seeing these very different pockets of infection. And unfortunately, it will probably lead to an ebb and a flow over the country over the next few months.
Doctor, my Twitter feed was filled with photos this past weekend in New York City. Lots of people out. Didn't look like they were social distancing to me. When you see photos like this, do you think we're at risk or running the risk of a pretty big second wave infection in the later half of this year?
It's not the later half of this year, right? The stuff that we're doing now, we're going to see evidence of in 2 to 3 weeks. It's way sooner than you would expect. And yes, I live in New York City and it was a gorgeous weekend. And we saw a lot of people getting closer than they should, not wearing masks in public. And actually, what it spells to me is we need better guidance how to live in this new normal over the summer. It's going to get increasingly less comfortable to wear a mask in public, especially if you're going to stay out by a pool or if you're going to stay in a park. And maybe it means that we need to have much better oversight of how people gather in parks and other outdoor environments. What I know is that people will gather, and that's okay because we have to resettle on this new normal. So we need to know the first question anybody out in a park should ask themselves is, where's the nearest place I can get a test in my community? If you can't answer that question right now, you probably shouldn't be going outside.
So, doctor, to follow up on that, who should be going outside? Is it just those people who have had a test? There are a few of them we know for antibodies. They say, okay, look, I've got the antibodies. So somewhere along the line, I had this virus, so I'm free to go back into society.
So I think actually everybody should be going outside for a short period of time. I think that the outdoor air is good for you and that it does remind us that we need to reframe ourselves and get some fresh air. But I think it's really about how we walk deliberately in the environment. If you have had the coronavirus and you have documented antibodies, it is true that you likely have a low risk to get it again, probably no risk, but we haven't proven it, and that you're wearing a mask really as a message to your other citizens that we're all in this together. But I have had the coronavirus, I have antibodies, and I walk outside with a mask. And so I think it's really about being in this together rather than looking for the immunity passports that are going to give us this next opportunity to engage in a very different way.
You know, I want to talk to you about some possible treatments because Gilead, has been in the news with its remdesivir treatment. They're saying that it could arrive in hospitals this week. Are you hearing the same thing?
Yeah, and I think remdesivir and its addition to the treatment options for patients that are hospitalized with coronavirus is very encouraging. But again, remember that this is a very small subset of the patients that are critically ill and hospitalized with this virus. We're looking at maybe 100,000 doses of remdesivir being available in hospitals over the month of May, and that matches less than the number of patients that are hospitalized. So we need to remember that it's one of our options, and if we can get people from the 11-day hospital stay to an 8-day hospital stay, which was the difference that they showed, that's encouraging. But it's certainly not the panacea that's going to change how we treat this virus from a public health perspective.
Dr. President Trump suggested that we may have a vaccine for the coronavirus before year end. Does that seem likely to you based on everything you're seeing?
So I think that the president suggests a lot of things that are optimistic and hopeful. And while I appreciate his optimism, I think we've never seen a virus get constructed for a vaccine for a coronavirus, and certainly not this fast in our history of creating vaccines, sorry. So I think that although we hope that a vaccine is created safely over the next few months and a year, it's certainly not what we need to lean into to figure out how to respond from a public health perspective. But I would be obviously overwhelmed and very excited at the idea of a vaccine coming out and being safe, and then being able to be scaled and executed as it needs to actually get us back to any other normal than what we're seeing right now.
I'd like your perspective. Probably tough for you to answer this, Dr. Kass, but do you see schools getting back in session only when there is a vaccine? Because without it, how do kids go back to school?
So I think that that's what we need to be thinking about over the next 3 months, right? Using the summer as a series of honestly successful and failed experiments on gathering, with the idea that the fall is our real goal to figure out how do we get kids back into school? How do we get our workplaces back to a new normal? I do see an environment where kids can get back into some sort of on-site learning without a vaccine, but it will be very different than what they were in even as recently as last December and January. We're looking for ways to keep kids safe and protected. The CDC came out with guidelines last week on how to gather in schools and day camps, maybe over the summer, but they're very prescriptive. They have a lot of limitations on how kids should gather. So I think we need to start thinking about those options and looking into them, because the vaccine I just don't see coming before the school year starts next year.
All right, Dr. Dara Kass, thanks as always for your insights. Appreciate it.
Thanks for having me.